So South Dakota is a Republican state. It is indeed a red state. And there's a pretty crazy article in the news here. This is from The Hill. It says South Dakota nurse says many dying patients still insist COVID-19, quote, not real. So the article reads, a South Dakota emergency room nurse on Monday expressed frustration that many of her patients don't believe they are dying of COVID-19. Jody Doering's tweet went viral on social media over the weekend after she tweeted about patients who, quote, don't believe the virus is real while gasping for breath on 100% vapotherm. It wasn't one particular patient, it's just a culmination of so many people. And their last dying words are, this can't be happening. It's not real. South Dakota reported 821 new cases of COVID-19 on Monday, with 62,521 current cases confirmed cases statewide. State Health Department reports 20% of hospital beds are currently occupied with COVID-19 patients. She also went on to say, people want it to be influenza, they want it to be pneumonia. We've even had people say, I think it might be lung cancer. Even after positive results come back, some people just don't believe it. Doering said multiple patients target nurses like her with their, quote, anger and hatred. They call you names and ask why you have to wear all that stuff because they don't have COVID because it's not real. I think it's just a belief that it's not real and nursing happens to be on the receiving end of that. It just makes you sad and mad and frustrated, and then you know that you're just going to come back and do it all over again. So it is pretty, I do feel really bad. I mean, I feel bad for nurses in general having to deal with this whole crisis, but it's got to be even worse to deal with people who don't believe that COVID is real for many reasons, because they're going to put other people's, health in harm's way. But also, you kind of get a lot of abuse and a lot of resentment as a nurse from patients who are just like, as she just said there, they think COVID's not real. So they're like, oh, fuck you for wearing all that protective gear and all that stuff. But I'm not surprised at this at all. I completely believe this, especially because who are the people who are more likely to get COVID at this point? First of all, the people who are most likely to really be hurt by it are older people. Older people are generally Republican leaning, so that's one thing. But also, people who are not following guidelines, wearing masks, social distancing, those kinds of things are typically Republicans, very heavily Trump supporters. So when those people catch COVID and they're inevitably, hospitalized, that's what they're going to do. They're going to continue to not believe it's real. And it's really scary and it's really unfortunate because this is sort of what Donald Trump has done, right? Trump kind of made excuses about, I don't want to create a panic, all that kind of bogus BS, total BS, by the way. It was just really, really damaging to society, and that's really ultimately the reason why Trump got voted out, is because people did not view him, and correctly so, as being able to handle this crisis, and actually that he really, really hurt this crisis. And so now you have millions of people who do not believe coronavirus is real, and so when they're hospitalized, they don't believe it's real. They're like, nah, man, this is lung cancer, it's pneumonia, something else. It's ridiculous, okay? And then nurses and health workers have to be on the brunt end of people like that. I also feel bad for nurses who, imagine being a nurse and just being someone of color and then having a racist patient, and they're just like, they're like, oh, I don't want treatment from you, or I don't want you to take care of me, or anything or something like that, because you're not white or whatever. That's got to be really fucked up too. You probably got to be on the brunt end of a lot of shit when you're a nurse. But definitely some pretty scary stuff, man. Definitely very, very unfortunate stuff, man.